Hey guys, okay, we're going to talk about some tips for Med-Surg nurses that are new grads into that area. So you're a brand new nurse, you've never worked in another area before, you're starting out on a Med-Surg unit. It's kind of overwhelming. So I have worked cardiac Med-Surg for years. I'm a nurse educator. I've worked neurocritical care as well, and I wanted to give you some tips as you transition into that role. So first of all, with Med-Surg, there is a lot of what's called throughput. So patients coming into the unit and patients going out of the unit, a lot more than like the ICU. So as the Med-Surg nurse, while you might start with anywhere from 4, 5, 6, or 7 patients, you're not going to end the shift with those same patients. You're going to discharge or transfer some and admit others, okay? So my tip for newbies into this area is to, number one, be ready for that, because it is a little frustrating to do all the work for 4 or 5 patients and then get rid of some and have to start all over with others. So know that that's part of the game, all right? Next is to really learn that admission and discharge process at your unique hospital backwards and forwards, because the quicker you learn that, the more efficiently you can complete the task, all right? So that means when you get an admission, and you've got your preceptor with you, don't kick back and let them run the show. You know, pay close attention to, these are the very specific things on this unit we do for each patient that is admitted. Everyone, no matter what, gets a weight, a blood sugar, an admission navigator, and blah, blah, or whatever that might be. This is how we set up a room for a new admission. And every hospital is a little different. So learn that. And take accountability and ownership to really learn it yourself, because it's very easy to kick back and allow people to do that for you, especially when you're new. But if you can say, okay, you know what, hey, preceptor, bud, can you hang back? Let me take the admission, and if you could just kind of watch and then give me feedback and then let me know what I missed, or walk through that process. Same thing with discharges. Discharges are a little more challenging too, because you have to educate patients as they go home about what to do, and that's kind of challenging when you don't really know what to educate them about or field their questions. But again, if you can watch your preceptor do a few of them and then kind of dress rehearse the discharge with them before you walk into the room with the patient, ask the preceptor to kind of hang back, let you run the show, and then ask for feedback afterwards. That's how you're going to get better at these faster. You can't kick back and you can't be passive about these and just hope that you kind of absorb the information and eventually become good at it. If you can lean into it, you'll get better at it faster, and then you can complete them better and with better quality. Next, get a good report sheet, guys. One mistake I made when I started out in Med-Surg was I felt like I had to get a good report sheet, and I would know it when I found it. And so I went 2 or 3 weeks doing a different report sheet at the beginning of every shift, trying to find the one I liked the most. But the reality is they're all relatively, the same kind of situation. So if you switch every shift, you can't really settle into it. And so if you get a sheet that some other people are using that they like, and then use it for a few shifts in a row, okay? And get used to where the boxes are, because the beautiful thing about a report sheet is you get it memorized and you know exactly where the boxes are and the prompts are, and you can just put them in, and that's what speeds up the time. You knowing where the boxes are and where the information goes, and you receiving information from someone else and plugging it into this so that you can reference it quickly throughout the shift. If you're switching report sheets all the time, you don't know where all that information is, and it negates the purpose, all right? So get a report sheet that you like, stick with it before you change it up, and at the end of this, I'll show you a report sheet that I highly recommend. Next, build rapport with those nursing assistants, okay? You can't come in guns blazing, ordering people around. I know that they're there to function to assist the nurses, and that's the name of their job, but we're all a team. That's kind of like someone joins a basketball team and you, maybe you have more experience, or maybe you're technically, at a higher level or whatever you want to say, and you've never met these people before, but you come in and you're telling them, you do this, you do that, super not cool, all right? I mean, we're humans interacting with one another. If you come in just ordering people around, even though it's their job, and I get that, there's still an ability or a need to gain, earn their trust, okay? They don't know if you know what you're doing. And a lot of us, if we're new grads, we don't know what we're doing. I didn't know what I was doing. When I came on the unit, those nursing assistants honestly knew more than I did at that point, and I needed to learn from them. I needed to learn how they did a bed bath and how they did it on this unit and specific things about that patient population. So don't come in like thinking that you're like, you don't need to build some time with them and rapport. You can't do that. If you want to be able to be a valuable member of the team, that means valuing everybody on the team. So encourage you to take some time to build rapport with them. That means giving clear, kind, direct instructions, following up with gratitude and, hey, thanks for doing that, and or helping them out when they need some assistance and they're drowning, because they drown as well. So any way that you can build rapport with them, I highly recommend. Encourage you to brush up on any disease processes that your patient population will have, okay? So Med-Surg nurses are probably dealing with heart failure, pneumonia, GI bleeds, renal failure, UTIs, COPD, whatever your unit is. Like I worked actually on a cardiac Med-Surg, so we had a lot of cardiac patients and Med-Surg overflow. So I got a lot more used to like cardiac kind of situations, telemetry, dysrhythmias and all that kind of stuff. But whatever your unique unit is, nursing school's over. You don't need to learn like a million things about a ton of different disease processes. I encourage you to notice what a lot of your patients on your unit are coming in with. And then when you got some time at home, read up on them a little bit. Dive a little bit deeper, not too deep right now. We don't need to go into every single reason someone might have colon cancer or COPD, but try to just understand that basic patho. Because if you can understand the basic patho, it can help you put the pieces together sooner, and that critical thinking falls in a little bit faster. So do that at home. Next thing is to get that time management routine down. A lot of nursing school did a great job of telling us things like ABCs, when the patients are not doing well, when they're unstable, who do we respond to first? What's the most concerning thing? And that's great. But when I think about my time as a nurse over the last decade, 20% of the time was probably dealing with that kind of stuff, right? When patients are not doing well, and I have got to utilize some advanced skills to understand what's my next step. But 80% of the time, patients were doing just fine. So how do I order my time and my steps on this unit to safely take care of these patients when I've just clocked in, I got report, I have a plethora of things that I have to do, I don't have a call light going off, and I don't have someone requesting something right away? How do I order my steps? At the beginning of my nursing career, what I would do is just kind of go from request to request. Before long, it's like, okay, wait a sec. I actually don't have a structure to get through my day, and I'm leaving a lot of things missing. So encourage you to pay attention to how your preceptor orders their steps. Ask them why they're choosing to do what they're doing. Know you're going to be inefficient at the beginning, and that's normal. It doesn't mean anything's wrong with you. That's you learning and settling into this role. So one of the things I created, because I noticed this huge gap, is a little email course. It's a few lessons. Under this video, you can sign up for it, and I will send you some emails every day for I think like 4 days, and it'll talk you through this is what you do realistically after you get report, things to consider, and how to order your steps so that you can start your day off on a good foot. So maybe if things go crazy later, at least, hey, we've got our assessments done, we've got our big chunk of meds at 9 a.m. or 9 p.m. given, and at least I'm kind of ahead of the game in that area. So that will be below the video if you want to check it out. So to review, learn your discharge and admission processes, get a good report sheet, build rapport with your nursing assistants, brush up on some patho, and get that time management routine down. Thanks, guys.